From Nzoia County, we really appreciate inSupply Health for choosing and partnering with us through this journey of improving our supply chain using impact team approach. I also thank our members who are here and those who are who are following online for making the impact team approach a success in our county. If you look at from the start, the journey for impact team started about 2 years ago when the team from inSupply Health visited us in our county, led by then Wamboi Waidhaga, to sign the MOU. We had our trainings, and from the problem statement, sub-county teams had a lot of supply chain data collected every month at the health facilities. The need to have quality data for decision making at all times has proven to be a challenge, as most of the staff do not understand the magnitude of decisions made with poor quality data. Most of the time you realize that staff were just reporting for the sake to complete the reports, but they didn't know that the data is also being used for supply chain, like it's already happening with the malaria. Data in the DHIS is used to determine what commodity counts. There's the knowledge gap among service providers, which was also coupled with the non-routine support supervision by sub-county health management team. And this is what upheld the problem, as it was easy to identify and respond to the emergency issue. When we started, our reporting rates were as low as 60% for family planning. There was poor data quality, incomplete reports or reports with the variance, that is ending and beginning balances. Like in March, the variance was at 86%. We had high stockout rates at the facilities, high wastage of vaccines, and low vaccine coverage. IMPACT is an acronym which stands for Information Mobilized for Performance Analysis and Continuous Improvement. So the sub-county impact teams is formed by a dedicated team of sub-county management members who ensure that all data, especially for supply chain, meet all the data quality dimensions. That is the timeliness, completeness, accuracy, relevance, precision, and consistency. The team meets on monthly basis to review performance of the previous months. The team usually review the data extracted from the ITT, which is the indicator tracking tool, after which the roles are assigned. Based on the gaps, the team members are assigned themselves the various roles, who will take what responsibilities. Roles are assigned to members in accordance to gaps highlighted. Then there is tracking using the action template of who is doing what in relation to the roles assigned. Usually at the end of it, there's usually recognition done during each meeting. Most of the time, it's usually just applause. Since the introduction of the impact team in Nzoia County, we have had a very improved commodity management system. And this is evidence. The national team who are here, I know they share the pager, the 2-pager, every month, and they just shared one yesterday. And if you look at the 2-pager, you compare the data challenges of Nzoia with our neighbors or any other counties, we only happen to be having a small problem. And this is because of the impact team approach. There is ease in identification of poorly performing facilities using for those who are outside there, you are taken through the tool. You can trickle down to the facility that is having issues. Enhanced analytical eye. Before someone does data entry in the KHIS, like it was highlighted some time back, you realize that a facility has reported 5,000 condoms. When you talk to that staff, they get confused. Even they disown their data. But after that, next time they don't repeat the same mistake. Improved reporting rates and timeliness, reduced wastage. Then there's increased vaccine coverage. ownership of the indicator by all the team members. Previously, before the impact team approach, people used to engage in blame game, so that whenever there are problems, everyone disowns it. No one wants to be associated with the problem. But with the time, people realize that making mistakes is not a big mistake. You own up the mistake and start the journey to correcting. A sub-county like Saboti, they moved from January from 91%, that is FP, to 100%. For immunization, you can see the vaccines, the absolute percentage difference. In March, we were doing badly, but by September, we had actually improved quite significantly. So experiences, team building, from the impact team, people realize that it's important to work as a team, and they realize that it's when each and every member is appreciated and given a certain role. So there was that team building of the team, work spirit among the team, impact team members. Monthly data review meetings have been happening. There's improved problem-solving skills using the RCA, capacity building. From the awards, you've realized that most of so many members from Nzoia have taken their impact the packages. In fact, feedback from Nzoia, they are saying, what of the 3 remaining personas? There are those who are already excited, they want to do the other packages that are not yet in the system. Attendance of indicator on impact team meetings by CHMT representative. So far, 4 members usually attend those meetings. Action planning, tasking of specific members of an action, which they follow up and they give feedback in the subsequent meeting. Then there was an improved commodity availability at the facility due to proper forecasting. What was our challenge is issues to do with the redistribution, that is a transportation of commodity. COVID came with these virtual meetings. It took time for some members to adjust. Then the issue of, in those impact team meetings, how do you award those who have improved? There was a challenge in that area. Lack of coordination, airtime, especially when you need to follow up on an issue at a facility. Then what we realize is that you sort out a problem at a facility, then another facility develops the same problem. But with the time, they keep on reducing. So that is where the recurring problem is, even after being addressed. Lesson learned, proper understanding of key performance indicators and consistent data review is key in improving and maintaining key performance indicator. Then use of data in decision making improves performance. Scheduled, consistent data quality assessment, such as the platform provided by Impact Team, improves the availability and quality of data of an organization. Teamwork is key in achieving agreed upon actions. Feedback and deliberations is important for implementation of action plans. Follow-up on action points is important in ensuring their implementation. Support supervision is not the only effective way, because previously people used to go for support supervision without knowing what they are going to address. So the impact team approach, where you look at the data before you go for support supervision, came in to improve. Every team member has a role to play, and lack of motivation is a silent killer.